Question 1. A practical nurse, PN, is caring for an older adult client with chronic heart failure who frequently becomes short of breath. The client expresses a desire to remain at home, but their family is concerned about their safety. The PN's primary ethical responsibility in this situation is to A. Advocate for the client's right to self-determination and living preferences. B. Advise the family on the legal implications of the client living alone. C. Recommend immediate transfer to a long-term care facility for safety. D. Document the client's wishes and family concerns without further action. Answer: A. Advocate for the client's right to self-determination and living preferences. The PN's primary ethical responsibility is to advocate for the client's right to self-determination, which includes their preference to remain at home. While client safety is paramount, the PN must first understand and support the client's wishes, then work collaboratively with the client, family, and healthcare team to develop a plan that balances autonomy with safety. This involves exploring available resources and adaptations that could enable the client to safely remain in their preferred environment, reflecting a client-centered approach to care. Question 2. A PN is preparing to administer an opioid analgesic to a client reporting severe pain, 8/10. The client's respiratory rate is 10 breaths per minute, and they are drowsy but rousable. What is the most appropriate nursing action? A. Administer the medication as prescribed and monitor closely. B. Hold the medication and notify the registered nurse, RN, or physician. C. Administer half the prescribed dose and reassess in 30 minutes. D. Encourage the client to take deep breaths and administer the medication. Answer: B. Hold the medication and notify the registered nurse, RN, or physician. A respiratory rate of 10 breaths per minute combined with drowsiness is a significant concern when administering an opioid analgesic, as opioids can depress the respiratory drive. Administering the medication could lead to further respiratory depression and adverse outcomes. The most appropriate action is to hold the medication and immediately notify the registered nurse or physician to obtain further orders or guidance, ensuring client safety and preventing potential complications related to opioid administration. Question 3. During a routine home visit, a PN notes that a client with newly diagnosed type 2 diabetes has several open, unhealed sores on their feet. The client states they have been trying to manage their blood sugar by eating less sugar. What is the PN's most appropriate initial intervention? A. Instruct the client on proper foot care and wound dressing techniques. B. Assess the client's current blood glucose levels and recent diet. C. Refer the client immediately to a podiatrist for wound management. D. Educate the client on the importance of insulin therapy for diabetes management. Answer: B. Assess the client's current blood glucose levels and recent diet. The most appropriate initial intervention for the PN is to assess the client's current blood glucose levels and recent diet. Unhealed foot sores are a serious complication of uncontrolled diabetes, and the client's understanding of eating less sugar might be inadequate. Understanding their current glucose control and dietary habits is crucial before providing targeted education or making referrals, as this assessment data will inform subsequent interventions and ensure a holistic approach to managing their diabetes and preventing further complications. Question 4. A PN is assisting with the care of a client who underwent a total hip arthroplasty yesterday. The client reports sudden, sharp pain in the operative hip and cannot bear weight. Upon assessment, the PN notes the affected leg is shorter and internally rotated. What is the PN's priority action? A. Apply ice to the hip and administer prescribed pain medication. B. Immobilize the leg and immediately notify the registered nurse, RN, and surgeon. C. Assist the client back to bed and reevaluate their pain level. D. Educate the client on proper hip precautions to prevent dislocation. Answer: B. Immobilize the leg and immediately notify the registered nurse, RN, and surgeon. The client's symptoms of sudden, sharp pain, inability to bear weight, a shortened leg, and internal rotation are classic signs of a hip dislocation, which is a surgical emergency after total hip arthroplasty. The PN's priority action is to immediately immobilize the leg to prevent further injury and promptly notify the registered nurse and surgeon. This critical step ensures that timely medical intervention can be initiated to reduce the dislocation and prevent long-term complications, highlighting the PN's role in recognizing and responding to acute postoperative complications. Question 5. A client with a new colostomy expresses fear and anxiety about managing the stoma and appliance changes at home. The PN's most effective approach to promote self-efficacy and independence is to A. Provide a detailed written step-by-step guide for colostomy care. B. Demonstrate a complete appliance change and ask the client to watch carefully. C. Encourage the client to actively participate in stoma care with guidance and support. D. Reassure the client that the home care nurse will manage their stoma for them. Answer C. Encourage the client to actively participate in stoma care with guidance and support. To promote self-efficacy and independence, the most effective approach is to encourage the client to actively participate in stoma care with guidance and support. This hands-on involvement, combined with consistent encouragement and positive reinforcement, empowers the client to gain confidence and practical skills in managing their colostomy. While demonstrations and written guides are helpful, direct participation fosters a sense of control and reduces anxiety, preparing them for successful self-care at home. Question 6. A PN is caring for a client with Clostridium difficile, C. difficile infection. Which personal protective equipment, PP, is essential when entering the client's room? A. Mask and gloves. B. Gloves and gown. C. Mask, gloves, and gown. D. N95 respirator, gloves, and gown. Answer B. Gloves and gown. For Clostridium difficile, C. difficile infection, contact precautions are required, which necessitate the use of gloves and a gown upon entering the client's room. C. difficile is transmitted through contact with contaminated surfaces or individuals, and its spores are not airborne, so a mask is not routinely required unless aerosol-generating procedures are performed. Proper hand hygiene with soap and water is also crucial, as alcohol-based hand rub is not effective against C. difficile spores, making adherence to these specific infection control measures vital. Question 7. A client is prescribed a new medication, warfarin. Which dietary instruction is most important for the PN to reinforce with the client? A. Avoid all green leafy vegetables. B. Limit intake of high-fat foods. C. Maintain a consistent intake of vitamin K-rich foods. D. Increase fluid intake to prevent constipation. Answer C. Maintain a consistent intake of vitamin K-rich foods. For clients taking warfarin, maintaining a consistent intake of vitamin K-rich foods is the most important dietary instruction. Warfarin works by interfering with vitamin K-dependent clotting factors, so sudden fluctuations in vitamin K intake can alter its effectiveness, leading to either increased bleeding risk or reduced therapeutic effect. While avoiding all green leafy vegetables is not necessary, consistent consumption helps to stabilize the INR, International Normalized Ratio, which is crucial for safe and effective anticoagulation therapy, highlighting the importance of client education on diet and medication interaction. Question 8. A PN observes a colleague consistently bypassing the hand hygiene station after providing client care. What is the most appropriate initial action for the PN? A. Report the colleague to the unit manager immediately. B. Address the colleague privately to remind them of hand hygiene protocols. C. Document the incident and monitor for future occurrences. D. Perform hand hygiene for the colleague at the station. Answer B. Address the colleague privately to remind them of hand hygiene protocols. The most appropriate initial action is to address the colleague privately to remind them of hand hygiene protocols. This direct, non-confrontational approach respects professional courtesy and provides an opportunity for immediate correction, which can prevent potential harm to clients. If the behavior persists after this initial conversation, or if there is an immediate risk to client safety, then escalating the concern to the unit manager would be warranted, demonstrating a commitment to patient safety and professional accountability. Question 9. A client with an indwelling urinary catheter complains of lower abdominal pain and a feeling of fullness. The PN notes no urine output in the past 2 hours. What is the most appropriate initial action? A. Increase the client's fluid intake. B. Irrigate the catheter with sterile saline. C. Check the catheter tubing for kinks or obstructions. D. Notify the registered nurse, RN, or physician immediately. Answer C. Check the catheter tubing for kinks or obstructions. The most appropriate initial action is to check the catheter tubing for kinks or obstructions, as this is the most common and easily correctable cause of a sudden cessation of urine output with accompanying discomfort. Before considering more invasive interventions like irrigation or notifying higher-level staff, the PN should rule out simple mechanical issues. Resolving a kink often quickly restores urine flow, alleviating the client's symptoms and preventing further complications, while demonstrating efficient problem-solving within the PN scope of practice. Question 10. A PN is reinforcing discharge teaching for a client with new onset asthma. Which statement by the client indicates a need for further teaching? A. I should use my bronchodilator inhaler when I feel short of breath. B. I need to get a flu shot every year to prevent exacerbations. C. I will avoid my triggers like pet dander and strong perfumes. D. I don't need to clean my inhaler because it's just medication. Answer D. I don't need to clean my inhaler because it's just medication. The statement, I don't need to clean my inhaler because it's just medication, indicates a need for further teaching. All inhalers, especially meter-dose inhalers and nebulizer components, require regular cleaning to prevent medication buildup, blockages, and the growth of microorganisms, which can lead to ineffective medication delivery or infection. Proper inhaler cleaning is a crucial component of asthma management to ensure medication efficacy and prevent complications, making this a vital point for the PN to re-educate the client on. Question 11. A client presents to the clinic with symptoms of urinary tract infection, UTI, including dysuria, frequency, and cloudy urine. A urine sample is collected for culture and sensitivity. The client asks if they should start taking their leftover antibiotics from a previous infection. What is the most appropriate response from the PN? A. Yes, taking antibiotics now will help you feel better faster. B. It's better to wait for the culture results to ensure the correct antibiotic is prescribed. C. Only if the symptoms become unbearable, otherwise, wait for the doctor's call. D. You should never take old antibiotics. They lose their potency over time. Answer B. It's better to wait for the culture results to ensure the correct antibiotic is prescribed. The most appropriate response is to advise the client to wait for the culture results to ensure the correct antibiotic is prescribed. Using leftover antibiotics can contribute to antibiotic resistance, may not target the specific bacteria causing the current infection, and can delay appropriate treatment. Emphasizing the importance of targeted therapy based on sensitivity results promotes effective treatment and reduces the risk of antibiotic resistance, which is a key principle of responsible antimicrobial stewardship. Question 12. A PN is reviewing the medication administration record, MAR, for a client, and notes a prescribed medication dosage is significantly higher than the typical therapeutic range. What is the PN's most appropriate action? A. Administer the medication as prescribed, as the physician made the order. B. Administer a lower, safer dose and document the change. C. Contact the prescribing physician immediately to clarify the order. D. Ask a colleague if they have seen this dose prescribed before. Answer C. Contact the prescribing physician immediately to clarify the order. When a prescribed medication dosage appears significantly higher than the typical therapeutic range, the PN's most appropriate action is to immediately contact the prescribing physician to clarify the order. Administering an unsafe dose, even if prescribed, can cause serious harm to the client. The 4 rights of medication administration include the right dose, and it is the nurse's professional responsibility to question and clarify any order that seems incorrect or unsafe before administration, ensuring client safety and adherence to ethical practice. Question 13. A client with dementia residing in a long-term care facility frequently attempts to leave the unit, stating they need to go home to care for their children. The PN knows the children are grown adults, and the client's home was sold years ago. What is the most appropriate nursing intervention? A. Physically redirect the client back to their room and explain they live here now. B. Engage the client in a distracting activity and validate their feelings of needing to care for their children. C. Request a physician's order for a sedative to reduce agitation and wandering. D. Install a high-security lock on the client's door to prevent them from leaving. Answer B. Engage the client in a distracting activity and validate their feelings of needing to care for their children. The most appropriate intervention is to engage the client in a distracting activity and validate their feelings, rather than directly confronting their reality. Clients with dementia often experience reality orientation as distressing, validating their feelings. You miss your children, that's understandable, and then gently redirecting them to a pleasant activity can reduce agitation and prevent further distress. This approach respects the client's emotional experience while ensuring their safety within the facility, adhering to person-centered care principles for individuals with cognitive impairment. Question 14. A PN is documenting care for a client who received a new pain medication. Which entry best demonstrates accurate and comprehensive documentation? A. Client comfortable after medication. B. Pain 3/10 after hydromorphone 1 mg 4 given at 1000. Tolerated well. C. 1000. Client reported pain 8/10. Hydromorphone 1 mg 4 administered per order. 1030. Client reported pain decreased to 3/10. Respiration 16. Alert and oriented. Denies adverse effects. Tolerated well. D. Client given pain meds. Pain better now. Will recheck later. Answer C. 1000. Client reported pain 8/10. Hydromorphone 1 mg 4 administered per order. 1030. Client reported pain decreased to 3/10. Respiration 16. Alert and oriented. Denies adverse effects. Tolerated well. The most accurate and comprehensive documentation entry includes the client's initial pain assessment, the specific medication administered, dose, route, time, and a post-administration reassessment including pain level, vital signs, G, respirations, level of consciousness, and any reported adverse effects or tolerance. This detailed documentation provides a complete picture of the client's response, supports continuity of care, and meets legal and professional standards, ensuring that all relevant information is captured for future reference and evaluation of medication effectiveness. Question 15. A client is experiencing symptoms of hypoglycemia, blood glucose 2, 8 mol/L, including shakiness, dizziness, and confusion. The client is conscious and able to swallow. What is the most appropriate initial action for the PN? A. Administer 1 mg glucagon intramuscularly. B. Offer 15 to 20 grams of a fast-acting carbohydrate such as juice or glucose tablets. C. Give a protein-rich snack like peanut butter crackers. D. Call a code blue and prepare for intravenous dextrose administration. Answer B. Offer 15 to 20 grams of a fast-acting carbohydrate such as juice or glucose tablets. For a conscious client experiencing hypoglycemia who is able to swallow, the most appropriate initial action is to offer 15 to 20 grams of a fast-acting carbohydrate like juice or glucose tablets. This provides a quick source of sugar to raise blood glucose levels rapidly. After 15 minutes, the blood glucose should be rechecked, and if still low, the fast-acting carbohydrate should be repeated, following the 15 to 15 rule until blood glucose normalizes, then followed by a complex carbohydrate and protein snack to prevent recurrence. Question 16. A PN is caring for a client with a history of recurrent urinary tract infections, UTIs. The client asks what they can do to prevent future infections. Which teaching point is most important for the PN to emphasize? A. To limit fluid intake to avoid frequent voiding. B. To wear tight-fitting synthetic underwear. C. To wipe from back to front after bowel movements. D. To urinate before and after sexual intercourse. Answer D. To urinate before and after sexual intercourse. The most important teaching point for preventing future UTIs is to urinate before and after sexual intercourse. This helps to flush out any bacteria that may have entered the urethra during activity, reducing the risk of bacterial ascent to the bladder. Other preventive measures like increased fluid intake, wiping front to back, and wearing cotton underwear are also important, but postcoital voiding is a specific and highly effective strategy for sexually active individuals prone to UTIs, directly addressing a common pathway for bacterial introduction. Question 17. A client is being discharged home with a new prescription for an ACE inhibitor. The PN should instruct the client to report which common side effect to their primary care provider. A. Weight gain. B. Dry, persistent cough. C. Increased appetite. D. Constipation. Answer B. Dry, persistent cough. A dry, persistent cough is a common and often bothersome side effect of ACE inhibitors, which, while usually benign, can significantly impact a client's quality of life and medication adherence. The PN should instruct the client to report this symptom to their primary care provider, as it may necessitate a change in medication. Recognizing and reporting this side effect promptly allows for appropriate management and ensures the client continues to receive effective blood pressure control without undue discomfort, promoting medication adherence and overall well-being. Question 18. A PN is caring for a client with an infected surgical wound. The wound culture results indicate methicillin-resistant Staphylococcus aureus, MRSA. What isolation precautions should the PN anticipate initiating? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Standard precautions only. Answer C. Contact precautions. For a client with a methicillin-resistant Staphylococcus aureus, MRSA, infection, contact precautions should be initiated. MRSA is transmitted through direct contact with the client or indirect contact with contaminated surfaces or equipment. This requires the use of gloves and a gown when entering the client's room and proper hand hygiene upon exiting. Airborne precautions are for diseases transmitted by small airborne particles, e.g., tuberculosis, and droplet precautions are for larger respiratory droplets, g. influenza, neither of which applies to MRSA, making contact precautions essential for preventing its spread. Question 19. A client with chronic kidney disease, CKD, on hemodialysis reports increasing fatigue, shortness of breath, and swelling in their ankles since their last dialysis session. The PN should prioritize assessment of A. Dietary intake and fluid restrictions. B. Blood pressure and heart rate. C. Lung sounds and weight. D. Activity level and sleep patterns. Answer C. Lung sounds and weight. The symptoms of increasing fatigue, shortness of breath, and ankle swelling in a client with chronic kidney disease on hemodialysis strongly suggest fluid overload. Therefore, the PN should prioritize assessment of lung sounds for crackles, indicating pulmonary edema, and the client's current weight, which is the most reliable indicator of fluid status in this population. These assessments provide critical information about the severity of fluid retention and guide immediate interventions or notification of the healthcare team, ensuring timely management of a potentially life-threatening complication. Question 20. A PN is preparing to administer medications through a client's nasogastric NG tube. What is the most important action to perform before administering the medications? A. Check the client's gastric residual volume. B. Aspirate stomach contents to check pH. C. Flush the NG tube with 30 milliliters of water. D. Place the client in a supine position. Answer B. Aspirate stomach contents to check pH. Before administering medications through an NG tube, the most important action is to aspirate stomach contents to check the pH, along with verifying tube placement visually and by measurement. A gastric pH of 0 to 4 confirms gastric placement and minimizes the risk of administering medication into the lungs, which could lead to aspiration pneumonia. While flushing the tube is also important, confirming correct placement first is paramount for client safety, making pH assessment a critical initial step in the medication administration process. Question 21. A PN is providing care for a client who is receiving continuous intravenous for fluids. The client complains of pain, swelling, and coolness at the 4 insertion site. Upon assessment, The PN notes blanching of the skin above the insertion site. These findings are most indicative of A. Phlebitis, B. Infection, C. Infiltration, D. Extravasation. Answer C. Infiltration. The client's symptoms of pain, swelling, coolness, and blanching at the fore-insertion site are classic signs of infiltration. Infiltration occurs when non-vesicant fluid leaks into the subcutaneous tissue around the insertion site, rather than entering the vein. Phlebitis involves inflammation of the vein, warmth, redness, pain along the vein, while infection presents with warmth, redness, pain, and possibly purulent drainage. Extravasation is similar to infiltration but specifically refers to the leakage of vesicant, tissue-damaging solutions, which typically cause more severe tissue injury. Question 22. A PN is assisting a client with advanced cancer to manage severe pain. The client's family expresses concern about the client becoming addicted to the prescribed opioid medication. What is the most appropriate response from the PN? A. Addiction is not a concern when medications are used for severe pain in cancer. B. We will monitor for signs of addiction and adjust the dose if needed. C. The priority is pain relief to ensure comfort. Addiction is a secondary concern. D. Tolerance and physical dependence are expected, but addiction is rare in this context. Answer D. Tolerance and physical dependence are expected, but addiction is rare in this context. The most appropriate response is to explain that tolerance and physical dependence are expected when opioids are used long-term for severe pain, but addiction is rare in this context. It is crucial to differentiate between physical dependence, normal physiological adaptation, and addiction, a psychological dependence characterized by compulsive drug-seeking behavior despite harm. This clarification educates the family, alleviates their fears, and ensures that the client receives adequate pain management without undue concern about addiction, promoting a focus on comfort and quality of life in palliative care. Question 23. A client newly diagnosed with hypertension is prescribed a low-sodium diet. Which food choice by the client indicates understanding of the dietary teaching? A. Canned soup. B. Processed deli meats. C. Fresh baked salmon with steamed vegetables. D. Frozen pizza. Answer C. Fresh baked salmon with steamed vegetables. Fresh baked salmon with steamed vegetables indicates understanding of a low-sodium diet because fresh, unprocessed foods are naturally lower in sodium compared to canned, processed, or frozen convenience foods. Canned soups, processed deli meats, and frozen pizzas are typically high in sodium due to preservatives and flavor enhancers. Choosing fresh ingredients allows for better control over sodium intake, which is critical for managing hypertension and promoting cardiovascular health. Question 24. A PN is conducting a pain assessment on an adult client who is nonverbal and grimacing. What is the most appropriate method for the PN to assess the client's pain level? A. Ask the client's family member to rate their pain. B. Use a numerical rating scale, 0-10, by pointing to numbers. C. Observe for behavioral signs of pain and use a validated pain assessment tool like the FLAX scale. D. Assume the client is in severe pain and administer a strong analgesic. Answer C. Observe for behavioral signs of pain and use a validated pain assessment tool like the FLAX scale. For a nonverbal client, observing for behavioral signs of pain and using a validated pain assessment tool, such as the FLAC, face, legs, activity, cry, consolability scale, is the most appropriate method. This approach systematically evaluates nonverbal cues to provide an objective assessment of pain, guiding appropriate interventions. While family input can be helpful, it should not replace direct nursing assessment using a standardized tool, which ensures consistency and accuracy in pain management for clients unable to self-report. Question 25. A client with chronic obstructive pulmonary disease, COD, is receiving oxygen therapy via nasal cannula at 2 liters per minute. The client suddenly becomes restless, confused, and their respiratory rate decreases. What is the PN's priority action? A. Increase the oxygen flow rate to 4 liters per minute. B. Encourage the client to cough and deep breath. C. Lower the oxygen flow rate and notify the registered nurse on immediately. D. Document the findings and continue to monitor. Answer C. Lower the oxygen flow rate and notify the registered nurse on immediately. For a client with COPD, hypoxemia is the primary respiratory drive, and administering excessive oxygen can suppress this drive, leading to carbon dioxide retention, respiratory depression, and worsening confusion. The client's symptoms of restlessness, confusion, and decreased respiratory rate suggest potential hypercapnia from overoxygenation. Therefore, the PN's priority action is to lower the oxygen flow rate and immediately notify the registered nurse RN, as this requires urgent reevaluation of the oxygen therapy and client's respiratory status to prevent further deterioration. Question 26. A PN is caring for a client with a new peripherally inserted central catheter line. What is the most critical intervention to prevent a central line-associated bloodstream infection? CLABSI? A. Administer prophylactic antibiotics as prescribed. B. Perform daily dressing changes using sterile technique. C. Maintain meticulous hand hygiene before and after contact with the line. D. Ensure the client remains on bed rest to prevent dislodgement. Answer C. Maintain meticulous hand hygiene before and after contact with the line. Maintaining meticulous hand hygiene before and after any contact with the PICC line is the most critical intervention to prevent a central line-associated bloodstream infection, CLABSI. Although daily dressing changes using sterile technique are important, consistent and proper hand hygiene by all healthcare providers is the single most effective measure in breaking the chain of infection. This fundamental practice significantly reduces the transfer of microorganisms, thereby safeguarding the client from potential life-threatening infections associated with central venous catheters. Question 27. A client expresses their wish to refuse a blood transfusion due to religious beliefs, even though the physician has explained it is medically necessary. The client is deemed competent to make their own decisions. What is the PN's role in this situation? A. Persuade the client to accept the transfusion for their health. B. Document the client's refusal and inform the healthcare team. C. Seek legal counsel to override the client's decision for medical necessity. D. Contact the client's religious leader to encourage acceptance. Answer B. Document the client's refusal and inform the healthcare team. Given that the client is competent to make their own decisions, the PN's role is to respect the client's autonomy, document their informed refusal of the blood transfusion, and inform the healthcare team. Coercion or attempts to persuade go against ethical principles of client-centered care and respect for personal beliefs. The PN ensures the client understands the implications of their decision and facilitates communication within the team, upholding the client's right to self-determination, even when their choices differ from medical recommendations. Question 28. A client taking diuretics for hypertension reports experiencing muscle cramps and weakness. The PN suspects an electrolyte imbalance. Which electrolyte is most likely affected? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer C. Potassium. Diuretics, especially loop and thiazide diuretics, are known to cause the excretion of potassium, leading to hypokalemia. Muscle cramps and weakness are common symptoms of low potassium levels. Therefore, the PN would most likely suspect potassium imbalance in a client taking diuretics who presents with these symptoms. Monitoring electrolyte levels, particularly potassium, and educating clients on symptoms of imbalance and appropriate dietary intake or supplementation are crucial aspects of nursing care for individuals on diuretic therapy. Question 29. A PN is preparing to administer insulin to a client. The client's blood glucose reading is 3.5 mol/L, normal range 4.0-7 8 mol/L. The prescription is for Novorapid 10 units subcutaneously if blood glucose 7.8 mol/L, or 5 units if blood glucose 4.0-7 8 mol/L. What is the PN's most appropriate action? A. Administer 5 units of Novorapid as it falls within the specified range. B. Administer a reduced dose of Novorapid, such as 2 units, due to the slightly low reading. C. Hold the insulin and notify the registered nurse, RN, or physician. D. Administer a fast-acting carbohydrate first, then administer the insulin. Answer C. Hold the insulin and notify the registered nurse, RN, or physician. Given the client's blood glucose is 3.5 mol/L, which is below the prescribed ranges for insulin administration for 0-7.8 mol/L or 7.8 mol/L, the PN's most appropriate action is to hold the insulin and notify the registered nurse or physician. Administering insulin when blood glucose is already low could precipitate severe hypoglycemia, which is a life-threatening emergency. This demonstrates critical thinking and adherence to medication safety principles, ensuring that the medication is administered only when clinically indicated and safe for the client. Question 30. A client is scheduled for a surgical procedure and expresses concern about signing the consent form, stating they do not fully understand the risks involved. What is the PN's most appropriate action? A. Explain the risks to the client again, simplifying the medical terminology. B. Witness the client's signature on the consent form and proceed with preparations. C. Inform the surgeon that the client has questions and has not given informed consent. D. Advise the client that they should trust the surgeon's judgment for their health. Answer C. Inform the surgeon that the client has questions and has not given informed consent. The PN's role in informed consent is to ensure the client understands the information provided by the physician and freely gives consent. If the client expresses they do not fully understand the risks, the PN must inform the surgeon that the client has questions and has not given informed consent. It is the surgeon's responsibility to provide detailed information about the procedure, risks, benefits, and alternatives in a way the client comprehends. The PN should not attempt to explain complex medical risks beyond their scope, and witnessing a signature when consent is not fully informed is unethical and legally problematic. Question 31. A PN is assessing a client with a new onset of severe headache, blurred vision, and numbness in one arm. The client's blood pressure is significantly elevated. What is the PN's priority action? A. Administer a prescribed oral analgesic for the headache. B. Obtain a detailed history of the headache characteristics. C. Notify the registered nurse, RN, or physician immediately for a potential neurological event. D. Reassure the client and monitor their vital signs every 15 minutes. Answer C. Notify the registered nurse, RN, or physician immediately for a potential neurological event. The symptoms of severe headache, blurred vision, numbness in one arm, and elevated blood pressure are highly concerning for a potential neurological event, such as a stroke or hypertensive crisis. The PN's priority action is to immediately notify the registered nurse or physician. Timely recognition and escalation are critical because early intervention in such conditions can significantly improve client outcomes and prevent permanent neurological damage. Delaying action to administer pain medication or gather more history could compromise the client's neurological function. Question 32. A PN is teaching a client about self-administration of subcutaneous heparin. Which site is most appropriate for the client to use for injection? A. Deltoid muscle. B. Ventrogluteal area. C. Outer aspect of the upper arm. D. Abdomen at least 2 inches from the navel. Answer D. Abdomen at least 2 inches from the navel. For subcutaneous heparin injections, the abdomen, at least 2 inches from the navel, is the most appropriate site for self-administration. This area provides adequate subcutaneous fat, is easily accessible to the client, and has fewer major blood vessels and nerves compared to other sites, minimizing the risk of complications like hematoma formation. The PN should also emphasize rotating injection sites to prevent tissue damage and ensure consistent absorption, promoting safe and effective self-management of anticoagulation therapy. Question 33. A client in a long-term care facility frequently refuses to participate in group activities, preferring to stay in their room. The PN knows that social interaction is beneficial for the client's well-being. What is the most appropriate nursing intervention? A. Insist the client attend at least one group activity per day. B. Encourage the client to discuss their reasons for not wanting to participate and explore their preferences. C. Document the refusal and leave the client alone, respecting their wishes. D. Inform the client that participation is mandatory for residents. Answer B. Encourage the client to discuss their reasons for not wanting to participate and explore their preferences. The most appropriate intervention is to encourage the client to discuss their reasons for not wanting to participate and explore their preferences. This client-centered approach respects their autonomy while attempting to understand underlying issues such as anxiety, fatigue, or specific dislikes. By understanding their perspective, the PN can tailor interventions, suggest alternative activities, or address any barriers, thereby promoting engagement in a way that respects their choices and ultimately enhances their well-being, rather than forcing participation. Question 34. A PN is caring for a client with a traumatic brain injury who is receiving enteral nutrition via gastrostomy tube. The client develops diarrhea. What is the most appropriate initial nursing action? A. Slow down the rate of enteral feeding. B. Administer an anti-diarrheal medication. C. Change the feeding formula to a higher fiber option. D. Discontinue the enteral feeding until diarrhea resolves. Answer A. Slow down the rate of enteral feeding. Diarrhea in clients receiving enteral nutrition can often be attributed to a too rapid infusion rate, formula intolerance, or infection. The most appropriate initial nursing action is to slow down the rate of enteral feeding, as this is a common and easily adjustable factor that can alleviate gastrointestinal distress. If the diarrhea persists, further assessment for other causes, such as infection or formula changes, would be warranted in consultation with the registered nurse or physician, ensuring a systematic approach to managing feeding complications. Question 35. A PN is assessing a client who is 2 days post-operative following abdominal surgery. The client reports increasing abdominal distension and has not passed flatus. The PN auscultates absent bowel sounds. These findings are most indicative of A. Peritonitis. B. Fecal impaction. C. Paralytic ileus. D. Small bowel obstruction. Answer C. Paralytic ileus. Increasing abdominal distension, absence of flatus, and absent bowel sounds 2 days postoperatively are classic signs of a paralytic ileus. This condition is a temporary paralysis of bowel motility, commonly occurring after abdominal surgery due to manipulation of the bowel and effects of anesthesia. While other conditions can present with similar symptoms, the postoperative context and combination of findings strongly point to paralytic ileus. Prompt recognition is important for timely management and to prevent complications like vomiting and dehydration. Question 36. A client with type 1 diabetes is unable to check their own blood glucose due to impaired vision. The PN is teaching the client's family member how to perform the blood glucose monitoring. Which statement by the family member indicates a need for further teaching? A. I should wash my hands thoroughly before testing. B. I will prick the side of the fingertip to get a blood sample. C. I will use the first drop of blood for the test. D. I need to dispose of the lancet in a puncture-proof container. Answer C. I will use the first drop of blood for the test. The statement, I will use the first drop of blood for the test, indicates a need for further teaching. The first drop of blood should be wiped away as it may contain interstitial fluid, which can dilute the sample and lead to an inaccurate, often falsely low glucose reading. The second drop of blood is typically used for glucose monitoring, ensuring a more accurate result. Proper technique is crucial for effective diabetes management, and the PN must correct this misunderstanding to prevent potential errors in treatment. Question 37. A PN is providing care for a client with a history of recurrent falls. The client's medication list includes a new diuretic. What is the most important education point for the PN to provide to reduce the risk of falls? A. To restrict fluid intake to decrease urinary frequency. B. To take the diuretic at bedtime to ensure efficacy. C. To change positions slowly, especially when getting out of bed or a chair. D. To avoid physical activity to prevent injury. Answer C. To change positions slowly, especially when getting out of bed or a chair. The most important education point for a client on diuretics with a history of falls is to change positions slowly, especially when getting out of bed or a chair. Diuretics can cause orthostatic hypotension, a sudden drop in blood pressure upon standing, leading to dizziness and an increased risk of falls. Teaching clients to rise slowly allows the cardiovascular system to compensate, reducing the likelihood of orthostatic hypotension and thereby significantly lowering their fall risk, promoting safety and independence. Question 38. A client with a new prescription for an antidepressant reports experiencing dry mouth, blurred vision, and constipation. The PN recognizes these symptoms as common anticholinergic side effects. What is the most appropriate advice for managing these symptoms? A. Increase fluid intake, use sugar-free gum or candy, and increase fiber intake. B. Discontinue the medication immediately and notify the physician. C. Take the medication with a large meal to reduce side effects. D. Use over-the-counter laxatives and eye drops daily. Answer A. Increase fluid intake, use sugar-free gum or candy, and increase fiber intake. To manage common anticholinergic side effects such as dry mouth, blurred vision, and constipation, the most appropriate advice is to increase fluid intake, use sugar-free gum or candy for dry mouth, and increase fiber intake for constipation. These are practical, non-pharmacological interventions that can significantly alleviate discomfort without discontinuing the medication, which should only be done under physician guidance. This approach empowers the client to manage side effects, improving medication adherence and overall well-being. Question 39. A PN is assessing a 5-year-old child admitted with dehydration. Which assessment finding is the most reliable indicator of the severity of dehydration in pediatric clients? A. Skin turgor. B. Tears and moistness of mucous membranes. C. Weight loss from baseline. D. Urine output. Answer C. Weight loss from baseline. Weight loss from baseline is the most reliable indicator of the severity of dehydration in pediatric clients. A 1% loss in body weight correlates to 10 milliliters per kilogram fluid loss. While skin turgor, tears, mucous membranes, and urine output are important assessment parameters, they are more subjective and can be influenced by other factors. Accurate daily weights provide a quantifiable measure of fluid deficit, allowing for precise fluid replacement and effective monitoring of rehydration therapy, making it a critical assessment in pediatric dehydration. Question 40. A client with type 2 diabetes is scheduled for a diagnostic procedure requiring NPO, nil PROS status after midnight. The client is prescribed oral hypoglycemic medication daily. What is the most appropriate action for the PN regarding the morning dose of this medication? A. Administer the oral hypoglycemic medication with a small sip of water. B. Hold the oral hypoglycemic medication and administer insulin instead. C. Hold the oral hypoglycemic medication and notify the registered nurse, RN, or physician. D. Administer the oral hypoglycemic medication and reschedule the procedure. Answer C. Hold the oral hypoglycemic medication and notify the registered nurse, RN, or physician. For a client who is NPO after midnight and prescribed oral hypoglycemic medication, the most appropriate action is to hold the medication and notify the registered nurse or physician. Administering an oral hypoglycemic medication without corresponding food intake could lead to severe hypoglycemia, especially with NPO status. It is crucial for the healthcare team to evaluate the client's blood glucose and provide specific instructions, which may include holding the medication or administering a reduced dose of insulin, ensuring client safety during the NPO period.